Welcome everyone. Thank you for your patience, and I'd like to welcome you to the second Healthy Seniors Pilot Project Showcase. My name is Candice Pollock, and I have the pleasure of moderating today's event. Bonjour tout le monde et bienvenue au deuxième vitrine du projet pilote sur les aînés en santé. I'd like to begin by thanking you all.
Welcome all and to the second Healthy Seniors Pilot Project Showcase. Although
from the traditional unceded territory of the Wolastoqey, Mi'kmaq, and Passamaquoddy peoples. This territory is covered by the Treaties of Peace and Friendship, which these nations first signed with the British Crown in 1726. The treaties established the rules for what was to be an ongoing relationship between nations. I'm grateful to have the opportunity to work on this land today. I'd also like to acknowledge that virtual participants are gathered on many sacred lands and traditional territories, so we encourage you to reflect on the land on which you're located and to consider your relationship to the land and to the people who are the traditional keepers of that land in a moment of silence. Before we begin the presentations, I want to share a few housekeeping items with everyone. First, we encourage you to participate in today's showcase in the official language of your choice. Simultaneous interpretation for the session is available in both English and French. To access simultaneous interpretation, please click on the globe symbol to the bottom right of your Zoom screen and select the language of your choice. On vous encourage de participer dans notre session aujourd'hui dans la langue.
We encourage you to participate in our session today in the official language of your choice. Simultaneous translation is available and can be accessed by clicking on the interpretation icon and selecting the language of your choice. The icon is usually accessible at the bottom of the screen and looks like a globe. I would also like to share a few administrative points with you before beginning the presentations. You should all have received the pre-showcase content. If you have a technical question, feel free to check out the tip sheet for Zoom or send a message to April in the chat. You can also follow the showcase from the agenda and documents shared in advance as pre-showcase content. You will notice that your microphone has been muted. This is to reduce the noise and interruptions.
We do encourage everyone to ask questions and share their comments. You can communicate with the speakers or other participants by using the chat box to ask your questions and share your thoughts. We'll do our best to share those questions with presenters during the panel sessions. Our team will also be writing questions in the chat box to engage you all to join in on the conversation. Please keep an eye out for those discussions and take the time to participate if you're comfortable. Lastly, please note that this meeting will be recorded. You will have access to the presentation slides along with other post-meeting materials, which will be emailed to you after the showcase. We'll also be sending you an evaluation survey so you can tell MEC2 how we did today and share with us your insight for future showcases. Now that we've covered the housekeeping items, let's get started with the showcase. The Healthy Seniors Pilot Project is a partnership between the Government of New Brunswick's Department of Social Development, the Department of Health, and the Public Health Agency of Canada. Today's session is hosted by the Monitoring, Evaluation, and Knowledge Transfer Unit, or MEC2, with the New Brunswick Institute for Research, Data, and Training, housed at UNB. Created in 2018, MEC2 is a partnership between NBIRDT and the Government of New Brunswick that was developed to support the evaluation and knowledge transfer components of the Healthy Seniors Pilot Project. Here to tell us more about this partnership is Elizabeth Dubé, Assistant Deputy Minister of the Department of Social Development with the Government of New Brunswick. Welcome, Elizabeth. I'll hand the floor over to you to provide some opening remarks.
Thank you, Candice. Can you hear me okay?
We can.
Perfect. Good afternoon, everyone. So I'd like to welcome you to our second HSPP showcase. As our population ages, we need to find innovative ways for our seniors to live safely, enjoy good health, and be active. The federal and provincial governments are committed to addressing the needs of this growing and diverse population and to helping Canadians live well as they age. So in particular, the Healthy Seniors Pilot Project, or HSPP, is an exciting opportunity to learn from new approaches and to help our seniors. HSPP began with a $75 million investment by the Public Health Agency of Canada in agreement with the Government of New Brunswick. Its goal is to help lay the groundwork for the dissemination of real evidence-based best practices to support healthy aging for New Brunswickers and older adults across Canada. Because of New Brunswick's high proportion of those over the age of 65, our province is an ideal environment in which to promote innovative approaches to support our seniors and healthy aging. The Healthy Seniors Pilot Project was developed to support a range of applied research initiatives to examine how governments can better support our seniors in their homes, their communities, and care facilities. I'm proud to say that we have 38 projects underway, 1 complete, and more that have been approved that are about to begin. These are a combination of community and government-led projects, with each one potentially impacting at least one of our 5 HSPP areas of focus. These focus areas, or the priority areas that we have, include improving social and built environments, using community approaches to reduce health inequalities, increasing independence, quality of life, and promoting healthy lifestyles, developing innovative care pathways, using supportive technologies to foster healthy aging, both at home and in our communities. For a full list of the projects, I invite you to visit the MEC2 website. The link has been included in the materials provided for the showcase today. In our first showcase, we highlighted a few projects for each of these 5 focus areas. If you did not have an opportunity to attend this excellent session, like myself, it is recorded, and you can find the link on the NB-IRDT YouTube channel. In this showcase, we will hear from a variety of our Healthy Seniors pilot projects and engage with them through a panel discussion. During our session, we will also want to hear from you. I encourage everyone here today, New Brunswick resident or otherwise, to reach out to these researchers, find out more, and push for the dissemination of evidence-based practices, such as these pilot projects, to support healthy aging. I'm confident that these projects will lead to positive impacts in the lives of seniors in New Brunswick, both now and in generations to come. Thank you and welcome.
Thank you very much, Elizabeth. Merci beaucoup.
Thank you very much.
Présentation,
Before starting with the presentations, I wanted to share with you the agenda for today. We will start with short presentations from each of our projects that will be followed by 3 discussions.
Might be improved by the projects that are currently ongoing. In the second panel, we'll ask our presenters to share with us their thoughts on how this research may change the face of population health in the future. Finally, in our last panel, each speaker is going to have the opportunity to share with us their call to action. What can we all do to improve the lives of older persons in New Brunswick? Before we jump into these important discussions, I want to welcome April English, the Knowledge Translation Officer with the Monitoring Evaluation Knowledge Transfer Unit. April's going to tell us a little bit more about the knowledge translation efforts for the Healthy Seniors Pilot Project. Over to you, April.
Thank you, Candice. For those of you who may not know, knowledge translation or transfer can have slightly different definitions depending on the organization or the country. So first, I'd like to review the meaning behind knowledge transfer or translation for the Healthy Seniors Pilot Project. So knowledge translation involves strategies to move evidence or the research into action. It involves dissemination, sharing information to increase a target audience's awareness and knowledge. And knowledge translation can also sometimes involve implementation as well, using strategies to change behavior, often in the form of a policy, program, or practice in the public health context. With the Healthy Seniors Pilot Project, the dissemination piece is our first step, sharing information about the Healthy Seniors Pilot Projects to increase target audiences' awareness and knowledge. Today, this showcase is an example of dissemination. As we move closer to the end of HSPP, March 2023, we at MEC2 are increasingly focusing our efforts on the implementation piece for projects. More specifically, we are focused on one particular stage of implementation, and that's sustainability. How can we at MEC2 help set up these pilot projects for sustainability so these projects showing beneficial evaluation results continue on and they're sustained, spread, or scaled up? And focusing our efforts on that is our focus for the next year. And some examples of doing so might involve informing these projects of various funding opportunities. Here I'm highlighting a few more examples of our knowledge translation goals and strategies with HSPP. In developing a knowledge translation plan, you may have different goals. One, which I've already touched on, might be generating awareness. And a strategy to generate awareness with our target audiences includes these showcases as one example. Another example of a goal includes building capacity in knowledge translation across our project teams. And with that, MEC2 hired myself, a knowledge translation officer, to assist our researchers in their knowledge translation efforts and provide that education and that training behind the scenes. This also included developing a knowledge translation plan more broadly for all of HSPP to make sure, again, that these pilot projects are not just pilot projects, but a reality for policy, program, and practice change. So many might be wondering, when will we get the actual results of these projects? When will we hear the outcomes and get hands on our materials? All pilot projects have different timelines. This means we cannot simply share all research findings and outcomes at once. This is why we have planned for multiple KT strategies or knowledge translation strategies at different times throughout the Healthy Seniors Pilot Project. So, for example, when we do these showcases, our aim is to share as much information about findings thus far. And then as we move closer to the end, so in 2023, we will start to see more outcomes, and thus more outcomes can be shared widely. When we do near the end, we do have some strategies in place to share those final outcomes, and we're planning an end of conference event, and we'll be developing a report for government on recommendations, and we'll also share some products on our MEC2 webpage, again, linked in your pre-showcase materials if you'd like to keep an eye out. On an individual project level, we're encouraging our projects to share results with their target audiences. So for example, a project might aim to share outcomes with practitioners of New Brunswick or with a First Nations community, all with their own goal in mind, such as policy change. Recognizing this is a very quick overview of our knowledge translation efforts and what I do day to day. Please don't hesitate to reach out if you're interested in learning more, and you may contact me using the MEC2 email, which is linked at the end of this presentation. Back to you, Candace.
Thanks so much, April. That was such a great overview of the knowledge translation strategy for HSPP. I think that probably answers a lot of questions for a lot of people. We're now going to get the chance to hear from our incredible showcase speakers who will introduce all of us to the projects they're working on, their key activities, and what they're hoping they will accomplish through their research. After we hear each speaker's project overview, we'll engage all of them in a series of panels to talk about the outcomes and how they believe that their projects will improve the lives of older adults, both in New Brunswick and the rest of Canada. On va commencer avec une présentation de Jalila Jbilou sur sa projet de
We will
recherche.
start with a presentation of Jalila Jbilou with her project called Promoting Physical Activity with Augmented Reality Experiences. Jalila, you have the floor. Thank you very much. It's a project that was developed with CIRA, the Center for Innovation and Research in Aging, and it implies implicates the Center for Medical Research of New Brunswick and the University of Moncton and the University of Toronto. We are three main researchers, Justin Henry and Dr. Marchnino, and the objective of this project is to put in place in the care centers and the communities a system or technology where we can pedal and see a screen where we can choose a path anywhere in the world. Imagine you're doing physical exercise at home and you at the same time visit the world. The idea of this project came from what we observed during the pandemic with this idea of isolation, the solitude, the depression, the lack of energy in a lot of elderly, and the fact that they were not able to be in touch with their family members. We thought that with this project, we will create a diversion that is also useful. They're having a diversion, they're exploring the world, and then they also are they're having physical activity. So they can pedal with their hands too. Some people who cannot pedal with their legs, they can pedal with their hands, with their arms. So you see, there are two objectives that are very important. One that is physical, doing the physical activity, reinforcing the strength of the muscles, the blood flow that is better. There are real physical benefits, but there are also a social, physical, social, mental effects. That's why this tool is called, what do you want to race with me? So do you want to race with me? I can connect with someone from the family who's outside the center, this care center. And there's this possibility to interact with someone else in another room also. It's possible. So there is this social aspect of connection, and therefore there is also an effect on the psychological well-being of the patients. It's a series of effects, physical, social, and psychological, and that's what we wanted with this project. We have two sites where we're implementing this. The site where we have the CIRA in Fredericton, and then we have another site in Moncton at the level of Mascaret. You see, we have two populations, a Francophone population and an Anglophone population, and we also have identified criteria to include more people. It is targeting especially people who have a certain strength physically. We're trying to concentrate on these people, but our objective is that later we might be able to help them inside their bed, people who are bedbound, and maybe they might be able to use this tool too, so that we will achieve our goal of mental, physical, social stimulation. And I will talk about the results that we could observe later. Thank you very much, Jalila. I appreciate the two objectives, physical and social, of your project. We will continue now with Martin Sénéchal,
His research project, the Band Frail Study, a provincial intervention to outweigh diabetes and frailty in New Brunswick. Over to you, Martin.
Thank you, Candice. All right, so I would like to start by just asking you to imagine someone who just got diagnosed with diabetes. So as time goes, this person will try to manage their diabetes. Some other disease that will develop. So maybe the person will start to have some hypertension, some cholesterol levels, some little issue with their kidney level. And as years goes, what's going to happen is they're going to increase their likelihood of developing some retinopathy, for example. So they might start to lose a little bit of the vision, or they might be at higher risk to have lower limb amputations. And eventually, what could potentially happen is that the cardiovascular system is going to be impacted, and they might die prematurely from cardiovascular disease, but related to diabetes. And along the way of the path I just described, and this is a pretty standard path for someone with diabetes. Along the way, they're gonna go through a phase where they're gonna have physical limitation and dependence issues as well. So this is why the benefit program is so important, because it really targets a high-risk population. So the benefit program is basically a lifestyle intervention, which include exercise, but also diabetes educations. It's a 16 weeks program, and the main outcome is really to enhance and improve physical function, quality of life as well, of people living with diabetes and also frailty. The program right now has about 100 people involved. We have 50 people who are into sort of a waiting list. The program has been put out there in New Brunswick in about 8 different sites. And originally, the program was designed to be delivered through the Diabetes Center. Now, because COVID-19 hit, we had to use a different approach, which I can discuss more in detail maybe later. But yeah, really, that's the project. The project is really a lifestyle intervention delivered in a way that we hope is going to be sustained over time, because we really think that people with diabetes need this type of approach, not just consultation.
Thank you so much, Martin. It sounds like there's a huge uptake for your project already, with over 100 people enrolled and 50 people on a wait list. That's very exciting news. We're going to be moving into our third presentation, and I'd like to welcome Isabel Macleod. Isabelle va nous parler de son projet de recherche qui s'appelle Approche douce et persuasive.
Isabel will speak about introducing gentle, persuasive approaches in dementia care to informal caregivers in the community setting.
New Brunswick, working with Horizon Health Network on this project. So for the Anglophones, the title of my project is Introducing Gentle Persuasive Approach, for short GPA, in dementia care to informal caregivers in the community setting. So GPA is widely used across Canada with formal caregivers of people living with dementia, such as nurses, care aid, personal support workers. But in this study, it's the first time that the GPA has been modified. It's online. It's a training that we call GPA Community. The aim is to teach family and friend caregivers of people living with dementia ways to respond respectfully with skills and confidence to behaviors associated with dementia. And the key elements of our project is to implement and evaluate the GPA community training among these caregivers. Based on the valuable feedback of our participants, we hope to make recommendations on how to improve this new training and how to expand this training throughout the province.
Thank you so much, Isabel. That was a great overview and a really quick introduction to your project. I'm looking forward to hearing more about it as we move through our showcase today. Our next presenter is Tracy Rickards, who will be telling us about her project, the Mobile Seniors Wellness Network, Reaching Rural New Brunswickers. Welcome, Tracy.
Thanks everybody. Really interesting project so far. So very quickly, I've presented about this project before at the showcase, but we've been doing some really neat things, and there are a lot of new developments as we move through. So what we looked at was that by and large, everybody understands that transportation is often the biggest problem for seniors in accessing almost anything. So we decided to make the healthcare team mobile and take it to them. So we use foot care as one of the things that we know seniors have very little access to as well. So we have nurses who are providing foot care, and then social workers who are working with the clients just to sort of see where they're at, what are their sort of needs. And by and large, it's been a really, really good experience so far. Most people have had a lot of issues that they've needed resolved. And some of the ones that I was looking through some of the files that we have, and most of the times it's about navigating the social development or social support systems that we have. So we find that even our social workers say that that process is so convoluted and so difficult that most people don't ever get through it, and certainly seniors who are who don't have internet access or don't have computer savvy or any of those kinds of things that you need nowadays. Some of the things that we've also done really basic is set up people with food bank deliveries or help them with rebuilding the banister on the stairs to in their home. So we're not doing rocket science. It's really basic stuff to help people, to support seniors really, to stay in their own home for as long as they can. One of the things that we did discover throughout the project so far, and we have about 125, 130 people enrolled in the project so far, is that foot care is something that seniors need, and there is very little access to it in the community. So it's critical, it's crucial, it's critical, and it's one of the things that we think will prevent unnecessary and expensive hospitalizations. So our goal at the end of the day is to make this project into a program and to have it funded so that we continue doing this for as long as we can, as long as we're helping people. And I'll stop there, let other people continue.
Thanks very much, Tracy. I really appreciate how you highlighted that, it's not rocket science. It's really just about doing those little things that can help people stay in their homes longer, but that they might have trouble doing on their own. And, there might not be a huge program to address fixing the railing on a staircase overall. Our next speaker is Jennifer Dobbelstein, who will be presenting on her project, which roughly translates, I believe, to where we are home where we belong, or Home for Life, an applied research study supporting independent living for Elsipogtog First Nation elders. Jennifer, please take the floor.
Thank you very much, Candace, and everyone. My name is Dr. Jennifer Dobbelstein, and I'm president of Dobbelstein Consulting Group and project lead for the study titled Emegdan Bleg, Home Where We Belong. The aim of our project was to explore what programs and services are needed by Elsipogtog elders to live in their own homes for life. And this was through 3 key milestones. Number 1, to conduct a research study looking at specific needs and issues, and evaluated 2 new programs. And right now we are working on developing and testing an evidence-based Home for Life assessment tool. And this tool would allow and assess their community in terms of how ready they are in terms of Home for Life and keeping elders in their own homes. Over the course of our project, I wanted to mention to you that 3 different meanings evolved for Home for Life. In the beginning, Home for Life meant to age at home for the rest of your life. And as we did the research, Home for Life became Home for Life. Home is life-giving, and people need to be at home, especially Indigenous elders. And then the third and very important meaning was that if people can't be home for life, this came directly from our research in an overwhelming way, that they want to be home in their own community to age in a more healthy way. So this was a big message, and it will have to change our thinking about how we care for Indigenous elders. So the evolution of the meaning has affected our goal, our end goal, and we now have a lot more to do. So what do we hope to accomplish? We hope to conduct an assessment of elders' needs about Home for Life in all of New Brunswick First Nation communities using a train-the-trainer approach, so that community members are taught to assess this. They would teach their own community members, so that it would be that kind of approach that we have used in our own research. And the second thing we hope to accomplish is to receive funding. We've applied for a grant for a follow-up project to build an elder care lodge at Elsipogtog First Nation, and to develop a program that's culturally based in care programming that would work well with the options for First Nations 7 generations continuum of care that Indigenous Service Canada is looking at, along with the Assembly of First Nations. So we will be looking at Indigenous Service Canada's upcoming knowledge exchange conference, first face-to-face conference in June. So we hope to get more involved with our partners on this next phase of the work then. Thank you.
Thank you, Jennifer, and thank you for sharing the evolution of the meaning of Home for Life. It was really insightful and gave me a good sense of what that means for the community that you're working with.
Thanks.
En prochain, je vais inviter France Chassé à nous joindre.
Now I'm going to ask France Chassé to join us. She will talk about the Madawaska Elders Initiative.
I'm pleased to present you the Madawaska Elders Initiatives, also identified as the MEI project. That project was born with a partnership between Madawaska Maliseet First Nation, represented by Micheline Plante, which is my co-lead in this project, and Université de Moncton Campus d'Edmundston, which I'm a full professor. The key activities of this project are to identify the health needs of the Madawaska Maliseet First Nation seniors living at home. When we then developed different initiatives aimed to respond to these identified health needs. We also trained seniors to use technology to demand different services or initiatives. The MEI project is designed to reduce barriers for elders in order to have an easier access to healthcare and services by using a mobile application placed on an electronic tablet connected to the Community Health Center of the Madawaska Maliseet First Nation. Improve access to healthcare, services, and resources allows seniors to stay healthy and live safely in their home. We were able to do this by adopting a participatory approach with the elders of the community, collect information about the elders' health needs and concern, develop initiatives that meet the elders' health needs, designed a mobile application available in both languages, hire a local company to develop the mobile application, hire and train the new global health assistant, create and register the mobile application in the Apple Store, train elders to use the technology to ask for services needed. Initial initiatives include local, provincial, and interprovincial transportation, help with mobilization during health appointment, translation services during medical appointment, home maintenance services, and also home care services. Every request is followed by a phone call on the same day. Mobile application permits to accumulate data about utilization rates and nature of each request. Users received an appreciation questionnaire 24 hours after receiving a service. New initiatives were added within the last year mostly because of COVID-19, like return home after hospital discharge, loan and adapted equipments, telephone follow-up, and friendly visits. With this project, elders become more independent and gain more self-confident. Elder feels safe at home and during transportation. Monthly technology utilization fluctuates because of restriction during COVID-19 pandemic. But after a year and a half implemented, the appreciation level is still very high. Elders mostly appreciate the courtesy, availability, accessibility, and flexibility of the MEI project. Thank you.
Thank you so much, France. I'm really looking forward to hearing about the outcomes that you just talked about a little bit more in our first panel coming up. Our next speaker is Danielle Kent, who will be telling us about her project, Introduction of a Non-Clinical Support Role for Care Staff in Nursing Homes. Welcome, Danielle.
Hi there, thank you Candace for introducing me. As Candace said, my name is Danielle Kent and I'm the research coordinator at the Lachlan Villa. The project that I will be discussing today is entitled Introduction of Non-Clinical Support Role for Care Staff in Nursing Homes. As a quick overview, and hopefully we'll get a little bit more details about this project as the panel goes on, but the project's key activities was placing non-clinical support personnel, which we called care assistants, on half the houses at the Lachlan Villa nursing home for a 14-week intervention. The care assistants were able to help with tasks such as delivering food trays, spotting mechanical lifts, pushing hydration carts, and assisting residents with other non-clinical tasks. Really, the main goal of this project was to try and enhance the delivery of person-centered care to residents while reducing non-clinical responsibilities for care staff, and with the overall goal of trying to accomplish better resident quality of care, family satisfaction, and job satisfaction for staff.
Thank you, Danielle. That was a really quick overview. And I think it's really interesting to hear more about what the role is that you've incorporated and what the specific responsibilities are. So I look forward to hearing about the outcomes shortly. Our last but not least speaker is Allison Luke, who will be sharing with us her project on co-designing dementia care in New Brunswick, building the future together. Allison, over to you.
Hi there. Thanks a lot, Candace. So my name's Allison Luke, and I'm a research associate at the University of New Brunswick, located in St. John, the St. John campus. And I'm one of the project leads for the New Brunswick piece, but I should start by pointing out that this project is kind of interesting in that we're part of a broader international group of folks working on the same thing. So within Canada, it's New Brunswick, Quebec, and Ontario. Although for our New Brunswick implementation, we were rolling this out in the entire province, which was kind of unique. And then in terms of our international partners, we're working with folks from Australia, the Netherlands, Poland, as well as the UK. So very basically, the key activities, the stages, there's 5 phases in this project that we've been moving through. We started with a needs assessment where we interviewed as well as handed out surveys to various stakeholders, specifically people who live with dementia, their caregivers or care partners, as well as health and social care providers, to try and just get a sense of the landscape around what their experiences have been with both like getting a diagnosis as well as that sort of post-diagnostic support phase and accessing services and resources and programs. This data was collected across all the various countries and partners. This phase was led out of the Netherlands, and they took all of this information, all of our findings, synthesized it, and this then moved us into a co-design phase. And this, in my mind, was one of the more exciting pieces of this whole project, because our goal to try and develop a really useful website as well as some toolkits was developed in actual partnership with people with dementia care partners and health and social care providers. So every country had to have a co-design workshop. We probably ran about 5 of them. They were led by a company who helped us design the website out of the UK, but at every step, this group had to give feedback, say yes or no, and it was everything from font, colors, images, language, what they wanted to see, all the way through to setting up what we now have as a website called Forward with Dementia. So that co-design phase was really, it was time intensive, but really necessary. So that's a really important piece I wanted to point out. After that, it was all around this. So we had to then finalize the development, implement, and in the New Brunswick case and across Canada, we launched our website Forward with Dementia back in November, and the launch time varied across the different participating countries. So the phase we're in now is we're going to be evaluating the use of the website. And essentially what we're trying to do here is really help to decrease some of the stigma around going in and getting a diagnosis. So one of the whole themes of the website is around how to live well with dementia, not to put some sort of Pollyanna like gloss on it, like, hey, it's great, but to really also take away this feeling that a diagnosis of dementia is essentially like a death sentence, which we've heard from people with dementia was how they felt when they received that diagnosis, or which is also why they tend to hesitate seeking a diagnosis, because they figure that once they get it, all is lost. So what we're trying to do is pull resources together, tools, the beauty of working with international partners. And we've also been working very closely with the Alzheimer's Society here in New Brunswick, as well as in Canada, is to really try and give people an extensive set of resources that they can rely on to help them move through this journey. And it has everything from stories from people who live with dementia to people who, we have resources from Dementia International, YouTube videos, books, resources. So it's very rich. So right now in Canada, we've had approximately to date 202,200 views on our website. And so we're just starting to get some data regarding the feedback. And so that will be hopefully what we'll be reporting on in the future, some of our findings.
Very exciting, Allison. Thank you so much for that overview of your process to getting to the website and also what you're hoping to accomplish. On that note, I want to transition us now to our first panel session. So I want to invite all our showcase speakers to return to the main screen and unmute their microphones. And also, I want to remind our participants that this is a great opportunity to ask your questions of our speakers. I will monitor the chat and I will try and get to them as time permits. To kick us off, I want to hear from each of our panelists what their perspective is on how life could be improved for older adults in New Brunswick as a result of your project. And Isabel, I was wondering if you could start.
Yeah, sure. Thank you. First spot. To give a little context, caring for a family member or friend living with dementia is not something that many people plan for, and requires specialized training and skill development. When the care provider does not understand the impact of the disease on the person or does not have the skill required to provide care for the person, it can create situation that can be stressful, frustrating, and even have safety issues. If, for example, they don't know how to respond appropriately to certain symptoms of dementia or certain behaviors that can arise associated with dementia. So by providing the GPA training, these caregivers have a better understanding of how dementia impacts the brain and the behavior of the person. So they have the why behind the behavior. And really, some of our participants said that they understood more the perspective of the person living with dementia, the person they're caring for. So they increase their empathy and compassion for that person. Also now our participants have shown an increase in knowing how to respond respectfully with confidence to behaviors associated with dementia. So overall, with this training, caregivers have developed skills and received tools to provide better care for the person living with dementia.
Thanks, Isabel. I like how you really highlighted that it's both about building empathy for the experience of the person living with dementia and about improving the caregiver's ability to respond to that and to meet their needs through building empathy. That was a really insightful approach to take, and I think we need that, right? And so that's really exciting to hear that.
Thank you.
France, I want to shift over to you. Did you want to answer this question?
Yes, thank you, Candace. First, our project aimed to reduce barriers for elders living at home to be able to access health services when needed. By doing so, and by training them to use mobile application on an electronic tablet, we also help them to and connect them to other services. During COVID-19 pandemic, because of the isolation, we were also able to connect them with their family, their friends. We were able to connect them with the outside world. So they became more independent, and they liked it a lot to be able to maintain, follow up the actuality, to listen to movies, or radio, to be able to also follow any different kind of education session, like to be able to have access to programs like physical activity programs, memory activities, also healthy recipes. So, and they became more confident with that. They ask to learn more about it. They want to order their be connected with the pharmacy to be able to update their medication and do things like pay bills, things like that. So by doing so, they became also less isolated. So we were really able to connect them. One thing that I would like to mention is be able to the purchase of a transit adapted vehicle by chief and council was a very, very important asset to our project, because by doing so, the elders knew that their community were behind them and wanted to get more involved and become make sure that this project would be sustainable after it ends. So well, that's basically it. We were approved to able to improve the seniors by our project.
Ross, I think you highlighted a bunch of really unexpected elements that the technology was used for, like recipes and transport. And I saw a question in the chat about unexpected research findings. Was there anything that came up during implementation that you didn't foresee coming?
Of course we did. Because of the pandemic, we started receiving requests from specific elders. And Micheline, are you there? My co-lead is supposed to be around. Can you talk about the experience about one of our patients who was at home with a lot of physical disability, and it was her family was taking care of him, and there was a bunch of health professionals coming at their home to help. And Micheline, are you there?
Yes, I am.
Take over and talk about a little bit about Bob's situation.
Yeah. Okay. We have a band member who did a stroke a couple of years ago, and he had very problem. He went to Quebec by emergency, and when he came back, he was disabled to do a lot of things. And he couldn't speak, he couldn't walk, he couldn't eat. So with the tablet there, we put some, I don't know how to say that, just the right word in English, but
rehabilitation programs.
What?
For
Rehabilitation
speaking, for
program.
memory.
Yeah. For speaking and memories and even speech, how to talk and all that. And it was very, very successful. His partner was able to learn about that too, about his condition. She was doing her gavage there. I don't know what's the word in English for that, but it was a very, very major success with the connecting to the health center, with the house that Bob was living at. Because of the COVID-19, there was a limitation of visit, but with the tablet there, it did this, how they say, is power, put it that way.
Thank you so much for sharing that story, Micheline and France. I think that really drives home the impact that the technology that you've put in place is having on your community. Shifting gears, but on the same note of technology and its potential to empower, Allison, I'm wondering, can you take a stab at answering this question and tell us, how do you think the Forward with Dementia website is going to be used to improve the lives of seniors?
Yeah, thanks. I do want to just start by touching on what France was saying with the use of technology. And I know that, and I will admit, like when I first went into this project, I was a little concerned about relying on websites. I mean, I think they can be very powerful, and that's obviously why we did this, but I always worried about those who would not feel tech savvy, seniors who don't tend to go into that sort of world. And I do think that one of the, if I dare say, benefit or something good that came out of the whole COVID pandemic is that people have learned to rely more on technology, because it's been a lifeline for so many folks, and especially in New Brunswick, where so many of our seniors are rural dwelling. So it really does mean they can learn about something, and we know knowledge can be power. So I think that very much for us was what drove this project. that what we hope is that a mix of sort of empowering folks, giving them the tools, the information, but not just the people living with dementia. Like when you visit the Forward with Dementia website, it's for people with dementia, their caregivers or care partners, as well as those who provide care in a professional capacity, whether through social services, healthcare. Because when we have stigma, that can cross all those different stakeholder groups. And to try and sort of do a course correct on how we understand living with dementia, that, you can live well. It can be a really difficult journey. But the more knowledge you have, a greater understanding of what the process will be like, the things you need to think about, can help to give folks more confidence, can hopefully reduce some of the stigma, and then can hopefully mean that we avoid some of the crisis situations that can come up when people are more in a reactionary mode as opposed to being proactive in terms of managing and living well with, in this case, a diagnosis of dementia. So essentially, when it comes to how can life be improved, what we're hoping is that both through the website, but also we've been part of the project is a campaign component. So we've had a couple of webinars to date that have been very well attended, upwards of 100 folks, and this would be primarily in New Brunswick. We're also about to do a French webinar, and the first one was just around what's the website all about? What's the background? What's this project? What can you hope to gain from it? And then our second one was more around the actual thing, like how do you care for yourself when you are either taking care of someone with dementia or you've been diagnosed with dementia? And just by doing that, as well as other marketing types of things through media, social media campaigns, we're hoping to sort of raise visibility about this topic, which of course, because we know as people live longer, we're going to see increases in the number of folks who are diagnosed with dementia. And so we really want to make sure that we're ready for this, right? So we want to see folks sort of start to feel more comfortable seeking a diagnosis and then managing that diagnosis. We want to see confidence go up. We want to increase folks' knowledge. And again, if they have more knowledge around what's out there, then potentially they will feel better when they're navigating this journey. And I mean, ultimately, we just want people to know that it's not, there's a lot of living that can be done once they get this diagnosis.
Thanks, Allison. Jennifer, I want to give you the last word on this topic before we go to our break and then our second panel. Did you want to answer this question?
Sure, thank you. I'll just take a few seconds. How could life be improved for seniors because of our project? Well, one of the big research impacts of our project has been that there's increased attention on the issues and needs of elders in the community now at all levels, with the managers at the health center, who are our planning committee, actually, for the whole project. We report to them, we seek their feedback and input throughout all activities. At the band council with band members and chief, with a lot of family members of elders. So this has been huge, and it really has opened people's ears to what the findings have been of our study, and it has taken the findings seriously. The community is taking them seriously. Various people are stepping up to help address some of the seniors pilot project. We focused on the two programs, the two findings that seem to be the priorities. Attention and specific band members that are responsible for those areas have really spoken up and helped without being asked to almost. So that's been a positive for us.
Thanks, Jennifer, for sharing how your research has really been mobilizing the community as a whole around the challenges and potential solutions. I really appreciate everyone sharing their initial thoughts on some of the long-term impacts of their research on older adults in New Brunswick. We've now reached the halfway mark of our showcase. I do want to give everyone some time for a quick break. You can get up, stretch your legs, get a coffee or another beverage before we can continue. We'll be right back in 5 minutes and we'll get started at 3:07 exactly. Welcome back, everyone. I know it was a short break, but I hope you enjoyed it. Maintenant que nous avons entendu nos conférenciers parler des impacts de leur projet.
Now that we heard the panelists present their presentations, we will to know more the potential impact of their work and the health of our seniors.
What you think the impacts of your research is on the future of population health as it relates to older adults? Tracy, are you still here?
I think she had to step out for a moment. Are you able to start with somebody else?
Yeah, we can definitely start with somebody else.
Okay,
Martin, do you want to start us off on this question instead and tell us a little bit about the relationship between the research that you're doing and population health?
I'm not sure, Martin. I think he had to step out as well. Apologies,
Okay.
Candace.
Sorry about that, everyone. I'm going to jump to Jalila then, and hopefully she is here. Third time's a charm, maybe? Excellent.
Yes, I'm here. Yes. Well, it's very important when we work with the elderly to make sure that there is an approach with individuals and with the population, general population. That's what we do with our project, working with people in nursing homes that are the most affected, but also people who prefer to stay at their home and could do it too. In this project and other projects, our results will improve not only the physical health, but also the psychological health. In each project, there is a perspective of the physical, social, and psychological aspect. We do not have many participants, we have 10, but we're starting to see reactions from the participants. People talk about pleasure and agreeableness. They say that they walked past and never known before in the province, but they're also discovering other countries. Someone told us that would have cost me thousands of dollars if I had to pay for all these bike tracks while I was still at home. So it increases the horizons of the people, and it's something extraordinary. And also we see a physical effect. We know how important it is for frail people, especially elderly. They are scared to go out. With our project, To Race With Me, allowed many people to see that their hands are stronger, they have less pain in their shoulders, they feel like they've done a super workout, so they're doing a physical exercise, so the effect is fantastic. And the cherry on top, talking about the health of the population, someone told us, and we think it's extraordinary, they said cycling was the treat of the day, and that was fantastic because we realized that beyond the benefits we expected, we have this emotions in the experience, so there's a closeness to this project. We will therefore have a positive effect on the future of population health. So improving the health of our elderly, we will also have an impact on the mental health of the families, of the social workers and the health workers who work with people. It's like a big stain of oil that is transferring to other people around these elderly in this project.
What a great explanation of the snowball effect that happens when you provide quality care for older adults and how that impacts all the people in their care circle, Jalila. I think, you know, you've made me want to get a 2 race with me device so that I can travel the world from home, since I can't travel the world either.
Oui, oui, le tourisme virtuel, une liberté, il y a plus de limites.
Virtual tourism is without limits nowadays. Yes.
Floor here virtually and ask you about the impacts of your project in the face of population health.
Absolutely. So of course, many of us know in nursing homes, especially like with COVID and everything going on, a lot of times staff are feeling a little short staff with who's actually available to be going to work. So having care assistants, that extra staff on the floor can really help with the quality of care that we're providing residents at the nursing home, and having more of a person-centered care as well. So what we did find for this project, when we did focus groups with staff, we found that care staff are often a lot less stressed and they have more time for their daily tasks when there's extra staff that or when the care staff are able to be there on the intervention floors. And we also found that, you know, there is a higher resident quality of care because it does enable care staff to have more time with each resident and they can provide better care. We also found that it enhances the resident staff bonding because residents do feel less rushed when they're receiving the care, and care staff could tend to residents' needs in a more timely manner. So an example that came up actually quite often was for residents, it felt more homey at the nursing home having the additional staff because, you know, when care staff were getting residents ready in the morning, you know, taking them down to the dining hall, it was less of an assembly line per se, and more high quality care being provided, and having that extra time to, you know, make jokes or have fun comments with each other than just kind of rushing through the motions of, you know, one resident to the next. So it does kind of create that more home sense at the nursing home for residents, as well to having the additional staff can really help with having more so like the second pair of eyes for safety with residents, especially if care staff are helping bathe the resident or if they're helping with care in different rooms. So just having someone circulating around the floor and making sure if anyone needs any help, they're there to assist in cleaning up any spills or whatnot that might be there. So it can really improve the quality of care and help seniors who are in the nursing home.
Thanks, Danielle. I'm hearing these really great narratives being weaved through the answers and the stories that you're hearing on the ground, which I think makes the impact of the work that you're sharing just so much more tangible for people in the audience. I want to ask Isabel if you wanted to talk about some of the impacts on caregivers of people or of people living with dementia, and how improving those caregiver supports really improves outcomes for both caregivers and the general population as a whole.
Sure. So there's a great deal of research that clearly indicates that when a family and friend caregiver have access to support that enables them to appropriately respond to the care needs of a person living with dementia, we can reduce crisis. We all know that crisis can sometimes create the most severe of financial pressure on the system. So for example, when intervention are used inappropriately or prematurely, like a department, emergency department visits that is premature. So we believe that the GPA training, alongside with other community support, which there's a lot on this call right now, can equip family and friend caregivers to potentially care for the person living with dementia in their community for longer, and ideally prevent some crisis situation.
Thanks, Isabel. Tracy, likewise, I think the Mobile Seniors Wellness Network identified some really important impacts for caregivers when it comes to improved access to community supports. Can you share with us in more depth the role that caregivers play in your project and what the potential future impact is of the Mobile Wellness Network for on both older adults and caregivers and the rural communities that they're serving?
Okay, that's quite the question. I'll do my best. I think one of the best places to start is to recognize that, first of all, that a lot of people have asked us, well, aren't you doing what extramural does, or are you just not, aren't you redoing or copying what extramural does? And I think what's really important is that no, we're not. That our focus is much different than extramural, so we're looking at, the focused on the social and emotional needs of seniors and decreasing socialization and loneliness and depression. So I think that the fact that it's mobile and that we're going out, and a lot of the comments that we've gotten back from our clients have been sort of around that, is that, it's just been so lovely to know that you are there and that we can call on you and that we're not alone. And I had one of the participants said that they felt like, gosh, it finally feels as if seniors aren't, just part of the trash kind of thing, that they're actually, that they are of value. I think one of the other things that I wanted to mention in terms of the future, hospitalizations for seniors that involve, foot ulcers and or diabetes and or that kind of thing are probably one of the highest contributors to first of all, unnecessary hospitalizations, and amputations, which immediately impact mobility, and we know that mobility is already an issue with a lot of seniors, and then untimely death or premature death. So those are part of the reasons why we felt that it was really important that we offer something like foot care to seniors who are living rurally. And I mean, in New Brunswick, it's all rural, right? So we have little cities, but so one of the things that we did do is we partnered with Dr. Karen Cross, who's a plastic surgeon, who's developed a tool which she called the Mimosa, which is a huge acronym that I'm not even going to try to. I'll just tell you what it is. So it's a camera that actually fits on the back of a cell phone. It sort of fits like, like there on the back of a cell phone. And it's got infrared, it's an infrared camera that can take sort of heat image pictures of feet. And what that has done is it shows us if the person has circulation problems before we can physically see them with our eyes. So we can stave off potential problems by addressing this situation early. And when we started the project coming on a year ago, we started with the first generation of Mimosa, and through the use by the nurses and the interactions with clients with using this tool, we're now up to a fourth generation. So they have continued to update and increase the capacity and the capability of the tool. I think one of the other things that I just wanted to mention in terms of the future is rent control. We've had, I can't tell you how many clients we've had who are renting in an apartment or in a low income facility, who have been what we call rent evicted. So somebody has bought the building and the rent has gone up beyond what they can afford. And so that they've been essentially they've been kicked out of their home essentially. But we've had quite a few people who we've helped with connecting them with, finding affordable housing for them. But rent control is vital for the future of seniors and really anybody in the province. But there needs to be something that we can do so that seniors who are living on a fixed income don't have to worry about losing the roof over their heads. That's it. I don't know whether I addressed your question necessarily, but
You've given me so much to pull from. I mean, I think you really highlighted the importance that health is not just about your traditional healthcare supports. It's about the entire, all the social determinants of health, and housing is critical. One of the other things that you picked at that I want to bring forward is when you talked about Mimosa, and I appreciate the name. It seems like one of the common threads across a lot of these projects is some form of technology-based innovation. And what I want to ask our panelists is, technology takes all of these research projects have this technology-based component, this innovation-based component. What would it take to get that technology integrated into the standard of care?
Yeah, well, I mean, it wouldn't take much to get it integrated into the standard of care. Any foot care nurse can use this tool. Is really very simple to use. That's one of the beauties of it. One of the hopes for Dr. Cross is that this can be marketed as a tool that people can use in their own home. So there's been lots of discussion about how do we make this so that seniors can actually use this thing and take the pictures of their feet, and then the pictures are uploaded to their physician or their care provider's portal, and so that it can be used in a much broader sort of capacity. The tool is not particularly expensive. It's not particularly technical. I guess it's an infrared. It's fairly, when I'm talking to the engineers, it's fairly basic in terms of what it is. But the help that it provides us with, and the opportunity for preventing unnecessary ulcers and unnecessary skin breakdown, and and ultimately amputations and whatnot, is just unbelievable.
Yeah, that sustainability piece is about the training and the cost, and the long-term integration. And Jalila, I want to give you the chance to answer that question too, because I'm wondering about To Race With Me and how that's going to be sustainably integrated into nursing homes.
Oui, effectivement, c'est quelque chose.
Yes, indeed. It's something that is part. We have developed what we call an integrated knowledge transformative strategy, ITT. And this strategy, it's a strategy for the social dynamics. We brought the people who are important to implement the intervention, the different stakeholders, and we started working together. The nursing homes or they are part of the project. It's not just researchers that are trying something and go with their project and results. We're creating a window of opportunities to change the practices and the ways of doing things in a nursing home, and working with people who are on the field. It allows us to understand better what are the determining factors, the challenges, and also the facilitators to implement this kind of interventions. And we are documenting all this, and we will create some sort of reference framework of indicators that will help other nursing homes, so that they will use them as a checklist to implement these To Race With Me project in their facilities, and so that they can follow proactively what is going on and maybe correct the course of their implementation, instead of throwing the baby with the water. I mean, we will adjust to what is happening, and this is part of the implementation strategy. We implement in an environment, we learn from the environment, and then we try to translate it into implementation strategies for another context, creating flexibility possibilities. All contexts are not the same. Therefore, it is important to consider always the possibility to expand or to transfer the good practices or the best practices, and to have the pillars that shouldn't be let be behind, and create also flexibility to adjust to the different contexts. So we're trying to see on the long term if we can do it in other nursing homes, but also someone spoke about it, I think, to make sure that it's not a project. It is a service that we're providing. This is very different. A project has a starting date and an ending date. A service has a long-term perspective and a continuous improvement perspective. So when we're talking about services and durability, it's a lot easier to implement the different initiatives and to keep them in the environment. And it's also easier to transfer them from one environment to the other. And that's what we're going to do. And Dr. Shidnell and myself, we're the researchers. Yes, we're interested by the context, but our mandate is also not only document what we see, but create opportunities for more research to go beyond and search for other environments and integrate them in our project, but also create expansion, possible expansion for this tool, improve the tool so that it will be easier to use, more pleasant, user-friendly. We started creating a small library of books that can be read, so they don't have to only listen to music, they can listen to poetry or to books. And you understand how important it is for people in nursing homes who cannot have conversations with others. It is cognitively stimulating. So it's like those babashka dolls, the Russian dolls, that one thing opens to another thing.
Thank you, Jalila. I think we've heard a little bit about co-design from across all our stakeholders, and the importance of making your stakeholders in this research project meaningful partners in the work that you're doing. And I think you really touched on the core of Healthy Seniors Pilot Project, is that it's not meant to be a project, it's meant to be a long-term change and a shift. And I do want us to shift gears here, and I want to hear from all of our speakers when it comes to the work that you're doing and the impacts that you've seen today and what you've learned so far. What do you think needs to change? What's your call to action to all of the people in our audience today to make a positive impact and really push the envelope forward on healthy aging, both here in New Brunswick and around the world? And to our audience, we want to hear from you too. Share with us your call to action in the chat and your questions here for our speakers. I want to kick this off first with Jennifer. Can you tell me, what's your call to action? What did you learn from this, and why do we all need to, what can we all do to improve healthy aging here in the province?
Well, Candace, I'll speak about our project, and I can tell you that our team envisions a future where Indigenous elders will age in their own communities with the development of an Indigenous continuum of care for long-term care. And this is a huge unexpected thing from our study. We didn't expect to find this, but when I was asked to go to the community to do this work, Eva Sock said to me, Jen, can you come and we can look at what the needs are of the elders, understand what's going on. And, the call to action really is to look beyond the needs and the services and the programs and look at what's the real problem. And we identified the real problem when we named it. We said there's no continuum of long-term care for the Indigenous people. And it's inequitable. It's time for that to change. What can we do about it? And I talked to my team members about my mom, who's 83, living in her own home in Fredericton. And she could access 14 services to help her live home for life. 3 of those are available to elders living at Dalsibokto. So the chief asked me when I told him that, why would that be? And I said, you know, the number of elders is skyrocketing in First Nations, and the programs and services and the system of long-term care hasn't been built to keep up with that. So, you know, that's a big call to action. I mean, once the needs are identified, you know, with doing an assessment in communities, I think that the next step is figuring out how to develop this continuum of long-term care. And it can be done. And I want to read you just a couple quick quotes in our findings from the elders. This is a quote from an Indigenous elder. "You can't stay home when you're sick. You need nursing care, need to get fed and medicine looked after. There's talks about a home here, but I don't believe them. When you are sitting home alone, that's not a picnic. No one will look after you." And another person said, "If we had a nursing home here, we can speak our own language and our own people can take care of me. I would move into a home." And one other, "I would love to see a nursing home and see our own Native people working there because of the language." So you see, we feel this call to action because we feel the culture. There are 3 or 4 of us that are non-Indigenous working on this project, and it's been an honor to have our team members from the community open up to us and teach us and share their language, their ways, their ceremonies, their traditions. We have done a talking circle with our ceremonial elder for focusing on the findings and how they made us feel, you know, an important thing to be part of, something that was amazing to experience. So this call for action for us is to take our work further to the next level, to pursue what steps that means to get there in terms of funding commitments and or policy commitments and policy change. And we're in the process of doing that.
Thank you so much, Jennifer. That was incredibly articulate. And, you know, the first point you made was that the first step of a call to action is to really understand the problem that you're trying to solve for. I think that's so critical. We often just kind of see an issue and we don't dive deeper into it. We immediately jump into our problem solving hat and try to fix and come up with a solution. But the idea of stepping back and learning from the people at the center of that challenge, what it is that they're experiencing and what it is that they need is a really critical first step in that call to action. France, I want to turn it over to you here because I think there might be some common threads that you can pull at.
Is it me? Thank you. This time I'll talk in French if it's okay with you. D'accord. Pour nous,
For us, concerning the initiatives for the elders, I mean, for people who want to stay home, what we got from that, the most important is that we want to have a call to action would be to have services, as we mentioned, a service network that are accessible from home for elders, but also that network be sustainable. So far, we have given a lot of responsibility to the natural caregivers, the members of the family, to take care of care and of networking for all those services. We understand now that that is not an easy thing to do. Who do we call when we need to have something repaired at home? Who do we call when we need to have a particular accessory to make it safer for our mother to move? So having a connection between those services is hard. So there has to be durable services, and that people who work within are paid for. In other words, approved positions with a salary, not just rely on volunteers and family. These people have goodwill, but at some point they become frustrated. And when that happens, when they leave, they aren't replaced. So that is one of the most important elements. As Dr. Jen said, we are working with a community, an Indigenous community, and all of our interventions are based on that culture. The people want to stay home. They want to be accompanied in their aging by people from their surrounding, their community, people they know, whom they trust. And it's important to have resources in place in those communities to have access to those services. So we believe the regularity of services, there has to be some remuneration, some salaries. It's essential. Funding older people are living for longer and longer lives, but their own salary is not going up. So it's important to have a safe environment for these people and appropriate housing for their needs. All right. Okay, thank you, France.
You really touched on the coming back to that social determinants of health and having resources within the community to support you to age at home or age in your community or age in the place of your choosing. And I want to flip that over back to Tracy to talk about that in the context of rural communities, which is, as you mentioned, makes up a significant portion of New Brunswick. What's your call to action for those communities, and why is it important that we have resources that are available to them in their communities that are specific to their culture and their lived experience?
I think there's two different things. So first of all, I think my call to action is really, and this has been an ongoing thing well before this project, and probably was one of the things that initiated the sort of the nugget to come up with this project. But I think the healthcare system is, well, we know it's broken, but it needs to be proactive and preventative. And right now it's just reactive, and it's so overwhelmed that it doesn't know what it's doing. So shifting the system to be more proactive will save the healthcare system so much money, but more importantly, far more importantly, it will help seniors age safely and to be able to stay in their own homes. So in smaller communities, one of our plans prior to COVID, which of course shifted a lot of people's plans on these projects, one of our plans was to look at what was available in some of these smaller communities, and were there ways that we could partner with other organizations like small nursing homes that might be, or special care homes that may be doing some interesting activities during the day that that some of the seniors might want to participate in, or just creating the connections for people, because a lot of the reasons why seniors become isolated is they don't know who to reach out to, they don't know how to reach out, and they don't know who to reach out to. So creating those opportunities. I love all of the wonderful technology that's been mentioned so far that sort of works at making links, but and I think that those, the tablets sort of ideas and connecting people that way is really a really neat way to get around the mobility, the transportation, the rurality of a lot of our seniors. But at the end of the day, it was, for a lot of our participants, it was that human interaction with another human being, that having somebody come into your home and just be there to listen to you, to talk. One of the things that we did with our project was we had a nursing student. Essentially, he went out to people's homes if they requested it, and just played cards with them, or helped a lady go to the grocery store, or just cut their grass for them. It's those little things that really help, and the system just isn't right now, is not built to sustain that or to even support it in any way that I can see. So my call to action is, let's change the healthcare system. I know that's big, but gotta start somewhere.
You got to dream big.
Dream big. Dream big.
Exactly.
Yeah.
Danielle, your project really deals with that issue of adding capacity, and of how overwhelmed everyone is, how there's not enough time, and so bringing in a new type of a care person to support that and to add that capacity. Do you want to tell us what's your call to action when it comes to improving healthy aging and the future of aging in New Brunswick?
Absolutely. I think to start off with, obviously with the healthcare system right now, we're seeing a lot of people leaving their positions, and a lot of jobs that need to be filled. So I think an innovative pathway needs to be taken for this. And one way to do it is hiring care assistants, because what they're doing are the non-clinical tasks, so that the care staff can really focus on that direct care that matters for the residents. And so I think by doing this, we're able to see, with the cost analysis too, like it's a reduction in cost rather than hiring maybe more care staff. So it's about a 35% reduction. So it can kind of help our healthcare system save some money, but also providing that higher quality of care and that patient-centered care that the residents in nursing homes require. The other thing too is talking a bit about filling those positions and making sure that we have people going into the healthcare system wanting to do these personal support worker positions, or LPN or RN. This is a great position to get people as like a stepping stone, get their foot in the door for these positions, so that maybe once they're in and they enjoy that job, we can have incentives and opportunities for people to continue their education and get more training, so that we are able to fill more of the healthcare positions that need to be filled. So I guess my call to action is hire care assistants for across the province and have them in these nursing homes, because they are essential. They do help residents, they do help care staff, and we really need them.
Thanks, Danielle. You highlighted a really important way that you're adding capacity to your formal care team. I want to switch over to Isabel and ask you about how you're adding capacity to informal caregivers, and how that's ultimately going to change the whole picture when it comes to healthy aging.
Well, je voulais juste aussi mentionner que j'ai raisonné avec ce que France a mentionné tantôt. Ça peut être un gros fardeau pour les aidants de prendre soin d'une personne atteinte d'un trouble neurocognitif. Donc, ils ont certainement besoin des outils et du soutien pour aider avec cette responsabilité-là. But also, going for English as well, the benefits of the Alzheimer's Society of New Brunswick being a lead on this project is that we have invested in communities around this province with the purpose of improving the lives of people affected by dementia and those who obviously care for them, the caregivers. So our mandate is to educate and support those impacted by the disease. And we have established both operational and partnerships enable us to effectively do this throughout the province. So what I mean by that is, for example, we're going to train some ASNB staff and other people that work with people living with dementia to become GPA certified coaches, so that this training can continue on after the project. These people can continue to apply the approaches taught in GPA with caregivers. And we have amazing partnership with Horizon Health Network, the creators of the GPA training, Age Inc., and many more, which will help us to continue capacity in the future with this training. And our call to action is really to encourage all of you, which it seems that everybody wants to do this, but we encourage you to continue to invest in essential specialized training for family and friend caregivers of people living with dementia so that they can potentially stay at home longer and have a better quality of life.
Thank you, Isabel. Allison, you're taking a different approach to supporting people living with dementia and their caregivers. From your perspective, how do you build off of that call to action? What else can we be doing?
Yeah, I mean, I think there's a lot more we can be doing. So to build on what Tracy and what others have said, I mean, our healthcare system is broken, and we hear this when in the needs assessment phase of this project, but in other research we've been doing where people speak a lot about the various, not just barriers in trying to access care, but also the gaps in the system. And the bottom line is we know that it can be very fragmented. And so this particular project we've been a part of has been, the way I see it long term, is it's one piece. It can support what we really need to get to, which I think, for instance, when it comes to people living with dementia and their caregivers or care partners, is to have maybe to improve care coordination through the use of, say, maybe patient navigators. I do believe that at the end of the day, we really need more of that in-person connection. And it can't just be about providing people with lists of resources, because that's a piece of it. But one thing we know from research we've done with caregivers, as well as with care providers, is they often, it's very hard to stay on top of everything that's available. Government programs, not-for-profit, community-based programs, they can be moving targets, right? Funding comes, funding goes, eligibility criteria changes. A lot of really smart people out there can find it really overwhelming to figure this stuff out, never mind the fact that, as we know with a lot of caregivers or care partners, is they're exhausted, and the people living with dementia themselves are exhausted trying to stay on top of everything. So I do believe that one way to potentially address some of these issues is having like that sort of patient navigator type role or a care coordinator type role to kind of help really navigate what is a very complex system. And I mean, that would be one of the things I see going down the road. But in terms of the sustainability of our particular project, because I also don't want to see this just fade away after all the work, is, we are currently looking at ways and how who can potentially house and maintain the website, because that in any future work could at least provide a good resource for other things. So it's a bit of an answer.
It was a great answer, Allison. I'm going to give Jalila the last word when it comes to a call to action. We've talked about the need for added human capacity. We've talked about the need for navigation services. We've talked about the need for really understanding the problem. Jalila, tell us about the need for and the role of technology in the future of healthy aging.
C'est très intéressant parce que nous, on vient compléter un petit peu.
Very interesting, because there's things that were said, and we were working on secondary presumption, and sometimes with the old people, we try to initiate them and bring them physical activity to their life, whether they're sitting or elsewhere in their life. And it's crucial that at every moment of their life, yes, people talk about the health system, and it always seems to be in a reactionary. And so this type of project allows to have, we can get somewhere in between the two extremes, find ways of solving current problems and trying to put out fires here and there, but there are also calls to action to help the people. And that's for trying to work early with people I mean, as well with even children and young adults, and even in their 50s, getting them to do physical activity. Of course, there are other behaviors that would help for health, balanced nutrition, and the good mental health, positive mental health, all these things. But often physical activity is linked, and often it's linked to fun. And so this is important. We just went through 2 years of a COVID pandemic, which really brought the morale down for everyone. And we see that there are losses that are social as much as anything else. But whether it's the older people or the younger people, we've been going through something very hard, and being active, always moving, is an important element. So if there's an important element when it comes to reaction, there's also having a prevention. Let's not neglect prevention. That is the most, our health depends on it. And I was listening to the different people talking about their projects. It's very interesting to see what's being done, but it's also interesting when we see what is being done with each of these projects. So those are very important parts. Thank you, Janina.
Work that has gone into all of these projects and the many other HSPP projects we didn't hear about today. And I think the diversity of those projects is really what's so important. You talked about the need for preventative initiatives, as well as the need for those initiatives that maybe put out some of the fires that we're facing. We've heard a lot here today about how overwhelmed the system is, and how overwhelmed our caregivers are, and our care partners are, and our older adults all across New Brunswick. So having those dual, those projects with those dual focus of dealing with the preventative measures and dealing with some of the fires that need to be put out. You know, the next step from here, when we look at sustainability, is really how do all of these projects intersect to create a healthier province, a place where all older adults can age at home and in their communities. How do we work together across all of your different initiatives to make that happen? So I do want to, on behalf of the team at the Monitoring, Evaluation, and Knowledge Transfer Unit, thank all of our speakers for taking the time to showcase your exceptional research in today's event. J'aimerais également remercier tous les participants de partout au Nouveau-Brunswick.
I would also like to thank all the participants for joining us from across New Brunswick to learn more about the work being done as part of HSPP.
Post-meeting materials. I saw lots of discussion in the chat about videos and other resources from these projects. Please look out for those materials and make sure to fill out the evaluation form so that MEC2 can identify areas where they can improve for the next showcase. If we didn't get to your question today, or you'd like more information on any of these projects, please get in touch with our presenters using the emails provided in the meeting materials, or with the team at MEC2 using the email on the screen right now. You can also follow along for future updates by subscribing to the New Brunswick Institute for Research, Data and Training newsletter, Data NB. Once again, thank you so much, everyone, for joining us today. Merci beaucoup à tous et passe une belle journée.
So thanks to all and have a great day.